I'll be your nurse today.
Hi, I'm Abby.
Nice to meet you.
Nice to
And
meet
what
you.
brought you in?
I've noticed lately that I've been gaining weight over the
Okay.
past few months, and I haven't changed my exercise routine. And then on top of that, I'm getting swelling in my hands and the feet area,
Okay.
so I'm kind of concerned.
Yeah, okay. Alright, well, I'm going to have you stand on the scale real quick
Okay.
with your weights. Okay. And you can just take a seat. And I'm just going to take a couple vitals, and then the nurse practitioner will be right in.
Okay.
So it looks like your blood pressure is a little bit elevated, but I do see here in your chart that that's been consistent for a while. But I will just let the doctor or the nurse practitioner know, and he can talk to you about that.
Okay.
Okay, well, do you have any other questions for me?
Nope, that's it.
All right, I'll let the nurse practitioner know, and he'll be right in.
Thank you.
Hi, Aubrey. Nice to see you.
Hi, Mr. Sanchez. How are you?
Good. So what brings you into my office today?
So lately I've noticed a lot of swelling in my hands and my feet, and I've also gained weight. I haven't changed my exercise routine, and I just feel so self-conscious.
I see. And how long have you noticed these symptoms?
I think about like 5 months now.
And how are these symptoms affecting kind of your daily life?
Well, I'm unable to wear my wedding ring. I can't
Mhm.
wear my strappy heels anymore, so, it's a downer.
Yeah, I see. Well, the condition that you're describing sounds like edema. In your case, it's peripheral edema because you have it in your lower legs, your ankles, and also your hands. And edema is the accumulation of fluid in the body that causes excess swelling.
Okay, what causes edema?
Well, there's a lot of things that can cause edema, like heart failure, trauma, and pregnancy. But in your case, I believe your edema is caused by hypertension. Looking at the vitals from your last 3 visits, it looks like your blood pressure has been higher than the desired ranges.
And why is hypertension so important?
Well, I'm really glad that you asked that question. Hypertension is a difficult disease to manage because most patients don't show any signs or symptoms. However, if hypertension goes unchecked, it can damage arteries and possibly lead to heart attack or even stroke.
And so, Mr. Sanchez, what do you recommend? What do you recommend for me to manage my hypertension?
Well, since you have stage 1 hypertension and edema, I want to prescribe furosemide, better known as Lasix. It's a diuretic that will help you get rid of the excess fluid in your body, and it's an antihypertensive medication.
And how often do I have to take it, and the side effects?
Well, I think we're going to start you on the lowest dosage, 1 pill a day in the morning for a month. Even if your blood pressure does go back to its normal ranges, I still want you to continue taking the medication until you see me again. Some common side effects that you might incur are diarrhea, constipation, abdominal pain. However, if you have severe adverse reactions like muscle fatigue, fainting, dry mouth, I want you to see me immediately.
Okay, and is there anything else I should know?
Well, since Lasix is a diuretic, it's important for you to stay hydrated. You're going to have to urinate a lot. Also, if you're taking any supplements or over-the-counter medications, I want you to let me know so that I can check for any drug-to-drug interaction.
Okay.
So I'll write you a prescription. It'll be ready at the pharmacy. Come see me in about a month so that we can check and see how Lasix has worked for you.
Okay, thank
Cool.
you, Mr. Sanchez.
All right, I'll see you.
I'll
Thank
see you.
Hi, Avery. It's
Hi.
good to see you again. How are you doing?
I'm doing great. How about you?
Good. And how's the weight? Does it gone
It's
down?
gone down
Okay.
and no more swelling.
No more
so
swelling.
I'm
Good.
feeling
That's what we
good.
like to see. All right. I'm just gonna check your weight actually in
Okay.
here, and then your blood pressure, and the nurse practitioner will be in. Okay. Looks like it did go down, which is good. Check your blood pressure. All right. So it did go down, which is what we like to see. Okay, do you have any questions for me?
Nope, that's it.
All right, I'll let the nurse practitioner know. He'll be right in.
Abby, welcome back.
Hi, Mr. Sanchez.
Nice to see you.
Nice
And you
to
brought
see you.
your identical twin sister with you.
Yes, how did you guess, Juliana?
Juliana, you guys look very much alike.
Thank you.
So Abby, tell me about this last month. Did you take Lasix and were there any side effects?
So I took Lasix like you told me to.
Mhm.
The swelling has gone down and I've lost the weight that I've gained, so I feel a lot better.
Good. You look better. And the vitals that Nurse Hannah took, your blood pressure has gone down to its normal range.
So does that mean that I don't have to take Lasix anymore?
Well, we're going to keep you on the lowest dosage for now, but understand the best way to manage your hypertension is with lifestyle changes.
Well, I have a concern
Okay.
because she has a pharmacology final coming up, and I'm really worried that this is going to spike up her blood pressure.
Well, stress can increase blood pressure, but the two ways to manage blood pressure is through diet and exercise. It's recommended that you get about 30 to 45 minutes of physical activity every day, so maybe you guys can go to the gym together or a hike or a walk and you can help quiz her. And also diet plays a really huge part in this as well. You know, sodium encourages fluid retention in the body, and sodium can be found in many of our favorite food like pizzas, frozen dinners, soups, bread. So if possible, maybe meal prep together and create, healthy meals throughout the week. And that will help you with your timing as well.
So I'm a busy mom and I don't, I'm also a nursing student, so I
Sure.
don't have that much time to prepare healthy foods. Is there any recommendations?
Well, I know it seems like big changes right now, so just try on these little shifts to see if if they work for you, and if you need further support, maybe we can talk about it at our next appointment.
Okay,
Do
perfect.
you have any other questions?
No, that's it.
Cool. Well, good job.
Oh, nice to meet you.
Nice to meet you too.